I call the honourable member for Longman.
Thank you, Mr Deputy Speaker. On the 10th of February, a community health forum was run in my electorate of Longman. I thank the Shadow Minister for Health, Peter Dutton, the State Shadow Minister for Health, Mark McArdle, the State Shadow Parliamentary Secretary for Mental Health, Drug Strategy and Health Personnel, Mr Andrew Power, Member for Glasshouse, for their attendance and support in addressing the concerns expressed by the attendees. The forum was organised in partnership with Lisa France, LNP candidate for Pumicestone, and was also attended by Darren Grimwaite, LNP candidate for Morayfield. Mr Deputy Speaker, this was an opportunity for the community to directly raise their concerns about health with the alternative state and federal government. It represents the approach I said I would take during the last election campaign. I said I wanted to bring the concerns of my constituents to Canberra rather than imposing Canberra on my constituents, and I continue to strongly believe that that can be my role. Many of the issues raised related to the shortcomings of the Caboolture Hospital: waiting times, unrealistic nursing workloads, insufficient funding, the services available to mental health patients, hospital administration and an onerous bureaucratic system were among the matters discussed. Mr Deputy Speaker, it is a fundamental right of Australians to expect access to quality health services. The hard-working medical staff at the Caboolture Hospital in my electorate do a fantastic job. But they need more resources and less bureaucratic constraints. Longman is one of the fastest-growing regions in Queensland, and demands on local health services are clearly strained, and we know that the demand will only increase with population growth. Under the Department of Health's own population projections, by 2026, the region's population is expected to reach some 200,000 people. We know that people want to move to our region. It is one of the best places in the world to live. But we also know that we can't put a gate up on the Bruce Highway and tell people to stop coming. But unlike the Labor Party, we do not want to play catch-up with health. We want to put more than a Band-Aid on what are very real problems. At present, there are 187 beds available in the Caboolture Hospital and 21 bays in the emergency department. An estimated 600 beds and 52 emergency bays are required to service the region by 2026. The AMA Public Hospital Report Card states that the Caboolture Hospital operated on average at over 100% occupancy, showing significant overstressing of capacity. A safe occupancy rate is of an average of 85%. Mr Deputy Speaker, it was again made evident that mental health is a major issue for my electorate. We have one of the highest suicide rates in the country, and Mr Deputy Speaker, mental illness affects more Australians than nearly all other health issues, particularly among young Australians. At the last election, the Coalition developed a mental health policy in consultation with Patrick McGorry and John Mendoza, designed to improve mental health care throughout Australia. For Longman, this would have had a very real and practical outcomes. A coalition government committed $60 million to the establishment of an early psychosis prevention and intervention centre in Caboolture. The centre is designed to service the Moreton Bay region and the northern suburbs of Brisbane, and would have had up to 20 acute and subacute beds for mental health patients. It was also designed to provide 24-hour care and outgoing patient services. Mr Deputy Speaker, this forum provided a great opportunity to listen to the concerns of my community. The Coalition is committed to finding practical, real solutions to health problems, working at a grassroots local level. Mr Deputy Speaker, the Coalition's health plans would deliver over health services to local hospital boards and eliminate bureaucracy, enabling doctors and nurses and other healthcare professionals to focus on patient care. We believe that a doctor or nurse at the Caboolture Hospital understands the health needs of our local area better than a bureaucrat in Brisbane or Canberra. A focus on patient care is needed. A health system where patient care is valued is needed, where a dollar spent on hospital is a dollar for patient care. We want a health system that values taxpayers' money and empowers healthcare professionals instead of restraining them with an excessive bureaucracy.